You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to the 2026 McKesson ideaShare Rewind, a Pharmacy Podcast Network exclusive series of on-site interviews captured inside the exhibit hall of one of the largest community pharmacy brainstorm events, empowering current and future independent pharmacists with deeper connections, new ways to innovate, and strengthen numbers for the voice of community pharmacy. This 4-part series brings you back to the action in Denver, Colorado. Thank you to the Independent Pharmacy Cooperative, IPC, for sponsoring this coverage of the 2026 McKesson ideaShare.
I'm Mark Kinney. I'm the EVP of Government Relations for Independent Pharmacy Cooperative, and you're listening to the Pharmacy Podcast Network.
Mark, it's so good to see you here at the McKesson ideaShare once again. I love being part of the IPC team here at the booth. It's been a wonderful show so far. How's it been for you guys?
It's been fantastic, Todd, and I live here in Denver, so it's...
You lucky.
Yeah.
Lucky. No airports for you, huh?
Right, yeah, and that doesn't happen very often, and so I'm glad everyone can come out and see my hometown and get a chance to hopefully get up into the mountains, and I know that a lot of people are going to the Colorado Rockies games tonight.
That's terrific. So let's talk about something. You were telling me that there was some legislation that's been passed. It's impacted 12 states out of our 50 states, and it's supposed to position our independent community pharmacies in a better position for getting reimbursed. And now it's being stalled by, of course, the antics of the PBMs itself. Talk to our listeners. What was that was passed, and then what's the impact of the next steps?
Yeah, Todd, these are referred to as commercial rate floors. And while there's been some cost-based models in Medicaid, it's now being expanded out to the commercial populations as well. And what this does is bring a transparent, objective payment model for pharmacies, community pharmacies. And this allows, I think, for everyone to see under the hood as far as what pharmacies are getting paid. These are generally surveyed actual costs. Some states have adopted on the product acquisition side the NADAC. But then there's also a professional dispensing fee that's associated with that, and those are surveyed. And many times the company that's doing that out in the States is Meyer-Stoffer. They do it for Medicaid, but now they also are starting to do it on the commercial side, and we've just been really successful. As you mentioned, there's 12, maybe 12 plus now after this last session. Mm-hmm. And I've worked personally in Montana and Colorado, Iowa. I know that Arkansas has passed a really good bill as well, and Kentucky more recently. But what we've found is the challenge is that while these laws go into effect, the PBMs have still found ways to either delay it or in some cases just say that they're not going to pay what the state law mandates.
It's just like a statement from them without saying anything, where they're just like, well, just come after it then. Like, come after us, and it's going to put it into legal, it's going to put it into the courts, it's going to take longer, it's going to cost more money. It seems like it's a game.
No, that's exactly right. And most of these statutes, the enforcement authority resides at the Department of Insurance in that each state. And so what we have to do is go knock on the door of the insurance commissioner and say, look, you need to enforce these laws. Sometimes that's received very well. Other times the insurance department is saying, well, we don't have the staff, we don't have the time, we don't have the resources. And so What we've done also is tried to bring in the state attorney general's offices to get them involved. Sometimes that means running additional legislation to make sure that they have enforcement authority as well. Other times here in Colorado, I think the Attorney General's office has been very receptive to, helping find solutions, to making sure that these pharmacies that, it was designed to be a lifeline for community pharmacy. We know that many pharmacies are closing down across the country. Not only independents, but chain pharmacies as well. So this really was designed, when we're at hearings at state capitals, where everyone knows what this is for, generally they pass overwhelmingly. Yeah. And yet what we find is when they're supposed to start, generally, beginning of the year and that, our pharmacists report that they don't see any change. In some cases, it's actually even worse than that because the PBMs will take the product acquisition cost, being NADAC, and then implement that, but won't implement the additional professional dispensing fee. So that actually puts our pharmacies in a worse position. And I had a pharmacy share with me just earlier this week, and we did meet with the Department of Insurance here in Colorado, but that pharmacy shared the remittance statements showing that they got a 10-cent dispensing fee and a 34-cent fee for the transmission of the claim. So not only were they getting paid, hopefully, their cost for the product acquisition, but on the professional dispensing fee, they were actually losing 20 cents, 24 cents.
Jeez. That's crazy. There's no way to stay in business that way.
There isn't. And, some of it is, I think purposeful, but others is another example that pharmacy brought was the same patient, same plan. They did get paid. In Colorado, it's $14.14 professional dispensing fee. On the other drug, it was like a buck. So some of that is just maybe incompetence. I don't know, but what we're seeing is it takes a long time. In Montana, we passed it. It's been in effect now for over 6 months. They're starting to catch up, but only because we've had to go to the regulators, right? The AG's office, the Department of Insurance, have them send out letters saying, hey, you need to follow the state law.
Mark, this has been good to catch up with you here in Denver. We so much appreciate your insights and what you do for independent community pharmacy, and we love your partnership with IPC, so thank you.
Absolutely. Thanks, Todd.
Hi, this is Eddy Sookswat, Senior Vice President of Commercial Strategy and Innovation at McKesson, and you're listening to the Pharmacy Podcast.
Eddy Sookswat, the Senior Vice President of Commercial Strategy and Innovation from McKesson at the McKesson ideaShare 2026. It's so good to see you.
Thank you. It's great to be here.
All right, first time on the Pharmacy Podcast Network. Are you a podcast listener?
I do. I do listen to podcasts.
You'll have to subscribe now to the network. We have 42 different shows on the network covering pediatrics and geriatrics and technology, and of course we're always press coverage at the major conferences. ideaShare is one of our favorite to be at because the energy here is so important to recharge as a collective independent community pharmacy base, to get together, to share ideas. That's kind of how ideaShare started. We know that pharmacies are taking on some more things, more responsibilities in terms of patient care. So from your perspective, what should they keep in mind when they evaluate tools and technologies and even AI to help support their growth?
Oh, it's a great question. You're absolutely right. Pharmacies today are being asked to do more and more. And this is a shift that's been driven, by patient needs, by regulatory, and just overall market dynamics. So community pharmacies, I believe, play a huge role in that and a vital role in patient care. So when we think about technology, the goal isn't simply more technology. The goal is better outcomes for patients and then ultimately better experience for patients. So when we think about technology and when pharmacies think about technology, those that will succeed will be more intentional and strategic about how they deploy technologies, where they deploy technologies in their workflow, and where they use it to help improve outcomes and patient experience.
All right, so you and I, before we started recording, talking about the pedigree and the deep adoption of technology inside McKesson in supporting independent community pharmacies. You guys have always been a technology leader. Talk to us about specific tools that McKesson has available to support our independent community pharmacies.
Absolutely. I mean, I'm fortunate enough to lead a lot of the technology businesses that support our McKesson distribution customers. And what we've learned is that technology is a fragmented, people are shifting from fragmented systems to more connected ecosystems. And those connected ecosystems link everything from ordering to inventory to clinical insights to patient engagement. And our tools at McKesson really aim to support that shift. So it's really about giving pharmacies the tools to run better, to operate more efficiently, and then ultimately manage their businesses day in and day out. So across our portfolio of technology solutions, we look to address a lot of these pain points and opportunities that exist within the pharmacy. So Supply Logics, it really is one of our products that connects real-time inventory and automated ordering to align supply and demand and minimize manual work within the pharmacy, which is critical in a community pharmacy where staffing levels are always going to be a challenge. We have services like Central Fill as a service, which help pharmacies manage peak prescription volume and staffing constraints by offloading high volume dispensing. And then we have LoopRx, which is featured here on the floor, which supports pharmacies by streamlining 340B replenishment workflows.
That's great.
Yeah, so I mean, it's a fantastic solution. It really reduces administrative burden. It ties manual processes and start to remove those manual processes by improving visibility to inventory and transaction credits. And then we have Connect, which is really how all of this comes to life. I think of McKesson Connect as the front door to our McKesson experience. And it's more than just an ordering platform. It brings together inventory, ordering, and insights into one place where workflows are designed around really helping pharmacies when they need it and simplifying their processes for how they order and how they engage with McKesson.
So, Eddy, when I started in pharmacy, it came out of telecommunications in 2004. The big deal back then was moving from these closed database pharmacy management systems, moving to open database like SQL or something. That was a pretty big deal. Now we jettison ahead 20 years later, and we're on the advent of a deep use of AI in our businesses. And as a publisher, I'm using AI to spell correct, which I know that's not a very, intelligent way per se to use it, but I'm always using it to spell correct everything. But I'm also asking it to better lay out complex topics into an easy way to understand, to help our listeners get more information quicker. Now, that's from a publishing perspective. There's a lot of conversation around AI in pharmacy. Where do you think it is having a real impact today, and how should pharmacies think about using it effectively and safely?
Yeah, and I think that's a great theme that you're seeing throughout ideaShare, but what we're seeing is AI is already making a big difference in pharmacies, where it's applied to more routine and time-consuming tasks. So I think pharmacies are less less focused on using it to augment their clinical processes, right? I think there are repeatable things that can leverage AI to really create more time and space for pharmacies to spend at the counter with their patients and being able to work through their needs and building those relationships and ultimately helping the outcomes for their patients. So pharmacies that really leverage AI to create that space within their practices is where we're seeing a lot of the value that is creating in their space.
All right. How many ideaShares has this been for you, Eddy?
This will be my third.
Oh, nice. Yeah, I think this is my fifth. And I just love, like I said, I love coming. I love the vibe. I love the energy. In closing, what are you most excited about in the future of independent community pharmacy?
Yeah, I think that AI is going to be something that will give time back, improve processes, improve workflow, and provide insights back to the pharmacists and their staff. So really they can get back to why they became a pharmacist, which is caring for patients, helping their community, and being a critical part of the healthcare delivery system. And I think pharmacies are positioned well to leverage some of these capabilities and start to experiment with them to ultimately improve how they can deliver care.
Eddy, thanks so much for being on the show.
Thank you. I appreciate it.
Independent pharmacy is the heart of community care. At Independent Pharmacy Cooperative, we believe your success strengthens the health and well-being of the communities you serve. As the nation's largest member-owned GPO, IPC helps pharmacies thrive with competitive pricing, profit sharing, and the support of a team who shares your vision. Let's build the future of independent pharmacy together and gain the freedom to farm. Visit IPCRX.com to start the conversation with an IPC representative today.
We are here at the 2026 ideaShare, the McKesson ideaShare, and I finally get to meet in person Kevin Boesen from Outcomes. I see you all over LinkedIn. We finally connected through LinkedIn, but it's better to meet people in person than just online.
I agree, Todd. I'm super excited to be here, super excited to meet you. Thanks for having me kick this off with you.
All right, I feel like a kid on Christmas morning who can't wait for his parents to get up, and I want to unwrap the present as quickly as possible. There is some big news in Outcomes that there's a whole new system and platform coming out, and that's the present I want to unwrap. So talk to us about the new system, the upgrades to Computer RX and RX30. Talk to our listeners about what's happening.
Yeah, super glad you asked about it, because it's even beyond the platforms itself. We've done a whole new experience model at Outcomes. We've really listened to our customer base. We spent a lot of time with community pharmacists to understand what their needs are. And so we've started with everything from customer support's better. All of our clients now have a dedicated client success manager. We've onboarded this fantastic new team, and then we've complemented that with some really cool feature enhancements. For RX30, we've redesigned the whole user interface. So if you're an RX30 customer who likes what you have today, you can use it. If you want a much more modern system, what we have is probably going to be the best-in-class user interface you've ever seen. So excited to show that. We've added things like automated data entry, so there's no more need for pharmacists, pharmacy technicians to manually enter those e-prescriptions that are coming in. So super excited about that. And then for Computer RX, we've done a lot of platform enhancements to improve stability, and then those things like automated data entry and all those workforce enhancements are now part of that process as well. So you'll see that roll out over the next couple months as well. So lots of cool things to be excited about.
That's incredible. So Outcomes as a company years ago, this is before your time probably on the team for sure, came out with a program to help the evolution of a pharmacist in the position of dispensing, to go deeper into clinical documentation, value-based care. You're kind of the OG in it in some ways. Now everybody, of course, is doing that. But talk to us about the melding of systems that were there for speed, they were there for reliability, and now you're starting to layer the pedigree of what outcomes started from. The whole name outcomes was because, hey, we're collecting data that the patient, what their outcomes will be for the pharmacist interaction. So talk to us about kind of the mixing all of that together.
Yeah. Everything that we're doing is designed to put the community pharmacist at the center of primary care. We really believe as soon as the next 3 to 5 years that the pharmacist will be the core primary care provider for management of chronic disease. So things that we've done with our dispensing systems, Computer RX, RX30, some of the workflow automation tools like pill count, virtual verification, are all meant to free the pharmacist's administrative time so that they can focus on clinical activities. And so to your point, the Outcomes brand comes from our long-standing tradition of working with payers and creating opportunities for pharmacists to earn non-dispensing revenue through clinical services. We're seeing a vast expansion of those heading from 26 into 27. So things like comprehensive medication reviews, adherence management, pharmacists doing blood pressure, A1C checks, asthma reviews, all of those are going to increase fourfold heading from 26 to 27. So that whole ecosystem of trying to make sure that the pharmacists have time to do that and then embrace those clinical services so that they are the really true primary care value prop in their communities.
I'm also very excited to announce to our listeners that Outcomes has joined the Pharmacy Podcast Network to drive more information, more conversations, more discussions. Do we get you back on the show, Kevin, in the future and get you talking with some of your pharmacy owners that are using outcome systems?
Yeah, Todd, I'm so excited that we're part of your network. That's huge for us. It's an honor for us to be included, so thank you for that. I will come back anytime. I love talking about pharmacy. I come from a very big pharmacy family. My brothers, my dad, my wife, we're all pharmacists. Like this is what I'm truly passionate about. So I'm super excited about it. Also invite people to follow us on LinkedIn, Instagram. You'll see a greater presence there. So Thanks again for including us.
Kevin, we are thrilled to have you. The intelligence, the camaraderie with the team. Shout out to the Outcomes marketing team. I hope this is a great McKesson ideaShare for you 2026, and we'll talk to you soon.
Yeah, thanks, Todd. You're the best.
Outcomes is back with another upcoming podcast series on the Pharmacy Podcast Network. Outcome's new podcast will go in depth on their advanced pharmacy software technologies with powerful clinical documentation modules and treatment management. Don't miss an episode. Subscribe to the Pharmacy Podcast Network wherever you listen to your podcasts.
Nick Seacrest here at McKesson ideaShare 2026. Nick, it's good to run into you and have time with you.
I know, it's awesome. Good to see you.
I've been watching you in the IPC booth. Every time I turn around, always like, hey, got to get Nick on the show. You were with the client. It's what you're supposed to be doing. You're supposed to be with the client.
Right.
But you've been busy. This has been a good show.
It's been awesome. Yeah, we've had met with tons and tons of customers and folks that we work with, trying to help them out with how they're ordering, how to optimize it, how to be better owners, and how to pay closer attention to the details, because that's where the dollars are, is in the details. So.
If I'm a pharmacy owner, if I were a pharmacy owner, I would not be able to pay attention to things like that. But talk to us about that optimization and how it's the lifeblood to keep your pharmacy thriving and being able to use that money to build something else for the community.
Exactly, yeah. So I think one of the things that's most often missed, just because of the complexity of it, is your primary wholesaler agreement. So we have a couple great options and a bunch of different partners we work with to help you not only understand your deal, but understand how to best optimize it. So everybody's mix of business is different, and how you think through how that mix applies to your customer base and the products that you're purchasing. You want to understand that so that you can best buy. So, McKesson's a fantastic partner. We love working with them. They're a great resource, but everybody has a sweet spot in their deal, and you just want to make sure you understand that and how to best utilize that. So.
And that's balancing the warehouse opportunities, the generic opportunities with the brand opportunities.
Correct. Yep. Finding that sweet spot and that balance. We have our one of our agreements that we have in McKesson is a phenomenal deal where we get full cost of goods on GLP. There's a balancing act with that, obviously, the economics of how the GLP products work and making sure you understand that per your deal and how to best utilize that great pricing we get from McKesson so that you can maximize the profit that you're when you dispense the prescriptions. So,
did you feel a energy at ideaShare this year that was different than last year? Because I seem to get that energy today.
Yeah, no, it's been a lot more lively. I think the industry as a whole, I think last year there's a lot of ambiguity still happening, especially the MTF and the IRA changes that were coming. I think that's gone much better than I anticipated, to be honest. Everybody's gotten a little bit of a cash bump in January because of the price changes that happened, and I would say, on average, on everybody's financials I look at and the people I talk to, I would say gross margin is flat to even up a tad this year compared to last year. And definitely the cash flow has been better because of that, those WAC changes and stuff like that, which has also bred more opportunities into how the deals are structured that you're with and how the mix has changed. And then on top of it, the IRA drugs, typically you're getting a better reimbursement when they reimburse you back to WAC. So that helps too. So I think it's been a pretty good year. I mean, think back over the last 10 or 15 years that I've been around.
Yeah.
I'd say this is probably one of the more stable to, dare I say, positive gross margins that I've kind of see more regular than I ever have in a long time. So it's definitely prior to DRRs, I would say.
Well, we appreciate you. We appreciate IPC. The energy on this series has been just incredible. The participation has been above average for sure. So we're excited to be part of IPC's communications team. We got to have you back on This Week in Pharmacy and
definitely.
Bringing in a couple of your pharmacy owners to really dig down into some of the details and share their successes. Like I like sharing with our nation and with our listeners the successes of the community pharmacy. It brings a lot of hope to others.
Oh yeah, and it's there. There's success all over the place. You just, like I said, the dollar's in the detail, right? You gotta see it and believe it and make it happen. So,
Nick, it's great to talk with you here at the McKesson ideaShare. Thank you.
Awesome, thanks, Ed.
This is Dave Randolph, and you're listening to the Pharmacy Podcast.
Dave Randolph, Pharmacy 50 alumni, most influential people in pharmacy. I think you were the Pharmacy of the Year award last year too here at ideaShare, right?
Yes, in Nashville.
Incredible. It's so good to see you. So good to have you on the show again. All right, there's something happening in TRICARE that needs demystified. I'd like to kind of get an update on it. We were talking about this before we started recording. Give our listeners a little update on what you know.
Well, TRICARE is, of course, a network for our veterans and active service members, and a lot of independents and chains are not participating in TRICARE because of how bad the reimbursement rates that were put out by the PBM that services that, which is Express Scripts. Mm-hmm. And literally, when you have big boxes not accepting it, you know that it's a garbage contract. Well, in my neck of the woods, which is western Nebraska, basically the only people out there that took it was Safeway and a couple of independents that were just being kind to veterans that we need to be. Yeah. And they were taking it at a loss. Well, in one situation, the Safeway closed, and now those veterans have to go 60 miles one way to get prescriptions. I don't know how they achieved network adequacy, except they did it by fax. You had to opt out of the contract. They sent you a fax. If you did not fax it back in, you were in the contract. And in fact, it happened to me. I was part of the network, and even though I opted out, and I had to go to Express Scripts and say, get me out of this contract. But thankfully, what is finally occurring in the Senate, Senator Elizabeth Warren put them on the carpet and said, this is going on. Pharmacies are not being reimbursed what they should be. Mm-hmm. Veterans and active service members are not having convenient access to pharmaceutical care. And Express Scripts, again, has been found in several cases, as well as other PBMs, to be overcharging the state the government, the employer, while pocketing the difference. It's not the pharmacies making the money, obviously, but it's the PBM that's pocketing that difference. And she called them to the carpet, as with other senators, to get an audit of the TRICARE system. And now it's got to go to the full House and Senate to get it done, but there is a lot of bipartisan support there. We just need to get it done to take care of these people. I mean, they've served us. We need to serve them. And I'm sorry, but I don't know an independent that doesn't want to serve their patients, and veterans especially. But we need to be able to do it and actually make money doing it instead of going out of business doing it. And so this is a very positive step, but we need to make sure that your federal legislators know, both in the Senate and the House, that, hey, let's get this ball, keep this ball moving going forward, and let's get this done at the federal level, because not only are veterans not getting good care, pharmacies are not able to take care of it, but you and I as taxpayers are footing hundreds of millions of dollars in
for
money
Express
that,
Scripts.
yes, for Express Scripts.
Yeah.
And, you know, when we're looking to cut money and we've got Doge out there looking to cut money, I'm sorry, this is low-hanging fruit. If you go look at PBMs, and the states have already found that in Tennessee, Ohio, you know, companies like Ford, they've found it as well. We need to be looking at that, because I don't know about you, but I'm tired of paying the amount of taxes I'm paying every year.
Exactly. And it's supposed to be taking care of our veterans, and it's not. And it's just making these organizations wealthy, and there's no care. And in some cases, like you said, they're driving 60 miles to go get a prescription from somewhere, and it's inconvenient. That's dangerous, especially for some veterans who might not even be able to drive. So yeah, that something has to happen for sure.
Yeah, and another great example is as a president of the association, I was doing a visit, and I was down in central Nebraska, and there was a woman there, a wife of an active service member, that was discharged from the hospital with a lengthy list of expensive prescriptions. And she was at an independent and couldn't get them filled and didn't know why and couldn't understand. So I sat down with her and explained it to her, and she had to drive an additional 60 miles after herself was discharged from the hospital, and her husband is currently serving overseas. How
crazy.
Fair is that?
Yeah.
I mean, her husband obviously has got a lot of more important things on his mind than trying to take care of his wife at home, and he shouldn't have to.
Exactly. All right, so for some good news, what is working in your independent community pharmacy to help you generate additional revenue and connection to your community?
Well, we do, of course, vaccinations. We do point-of-care testing for strep and influenza.
Good.
We do a lot of natural minerals, vitamins, minerals, and supplements care planning, which I like to look at a patient and say, yeah, we can take care of them with Western medicine, but I like to look at the whole patient, because a lot of patients don't want to do that. And in some cases, they've suffered from side effects or allergic reactions that we can use a vitamin or a supplement and get the same or similar results. So that's going really well. I have a wound care nurse that is seeing patients, and that's been a huge blessing for patients that, you know, our healthcare system's overwhelmed. I don't care if you're a hospital, a clinic, a PA. So anytime that a pharmacy can step up and help out, like we have forever, especially since COVID, we need to do that. And we need to be reimbursed for that. But that's something that we've been able to do and offer that service, and it has helped out a lot, especially elderly patients in long-term care, that it's taken a burden off of those facilities so they don't have to drive them, in one case, 60 miles one way, just for wound care. So that's been going really well as well.
That's really interesting. And what about the evolution of long-term care pharmacy services at home? And then you get reimbursed at the rate that a long-term care pharmacy would get reimbursed. Is that something else that you're implementing?
Yes, we do that as well. Now, every insurance does not cover that, but there are a lot that do, and that is a big blessing, because let's face it, you heal better, you keep your health more or better if you're at home.
Yep.
You know, I don't care if you're 15 or if you're 85. And so if we can keep those people in their homes for a longer period of time, we will see longer lifespans, better overall health, and better quality of life. And let's face it, I had a grandparent in the nursing home. It's not the nursing home's fault, the long-term care fault, but they're expensive.
Yeah.
And so if we can keep them at home as long as possible, the family can also benefit financially from that too.
Excellent. Dave Randolph, it's so good to see you. It's so good to have you on the show. Appreciate you giving us your time. I hope you have a wonderful McKesson ideaShare 2026.
Been good so far. Well, thank you, Todd.
Hi, this is Jimmy Pappadeas. I'm the Chief Client Officer at Scripted, and you're listening to the Pharmacy Podcast.
All right. David and Jimmy from Scripted, welcome to McKesson ideaShare's podcast press coverage. It's so good to see you because I've heard about you guys from LinkedIn, and I was extremely curious. Just right out of the gate, Jimmy, what do you do at Scripted? How does Scripted work for independent community pharmacy?
Yeah, well, Scripted is a platform and service that helps independent community pharmacies prescribe for medications and also gets them paid. Helps them set up a clinical care center and helps facilitate medical billing in the states that allow it so they can get reimbursed for those same services.
All right, so talk to me about the marketplace. David, what is independent community pharmacy? What is the challenge right now from being dispensing focused to more clinically focused, and how does that affect revenue?
That's a great question, Todd. The thing is, more than 300 pharmacies closed down last year, and they're feeling the squeeze from PBMs cutting down the dispensing margins. So they're looking for additional opportunities, and one of those opportunities is providing clinical services. So picture this. Wouldn't you want, as a pharmacist owner, to allow a patient to walk in, get seen, tested, and treated, then have your pharmacist prescribe and fill the prescription for you? You walked in, and then you walk out 15 minutes later with your prescription in hand. No need to see a doctor, no need to go to urgent care. You're in and out, and you're good to go.
So where is the prescription initially coming from? Is it a telehealth tie-in to a physician somewhere else, or how is that working?
Yeah, so the prescription would be coming from the pharmacists themselves. So we work within the bounds of the state, right? So there's different states that allow prescriptive authorities in different ways. The most common pathway is going to be a collaborative practice agreement, right? We'll find a physician in that state if it's allowed, and that allows them to have delegated authority. They can follow the protocols that are built into our platform. Makes it very simple to document, to know what to ask. Sometimes the questions are asked of the patient, right? They can schedule an appointment. Those questions, they're just reviewing the answers, and it basically works like that. The other way that can work is states do have statewide protocols, so we also have protocols that match those. So even if that's just the pathway, they can take advantage of it. They don't have to do documentation on paper. It can be very streamlined.
All right, so how does it work with my existing pharmacy management system? Talk to me about the API or the connection, or how's that working?
Yes, so we like to split it in. Pharmacy management is still core for all prescriptions, anything with inventory, or especially for immunizations going to the registry. For clinical things, especially for billing, that's where we come in. We can be just one extra tab. And it's usually pretty seamless when it's done that way, because pharmacy management systems aren't meant to document visits in that way, and it's a collaboration, right? And if you're doing anything from the immunization side, we can actually import that data to make it cleaner, right? And we just handle the billing in that case. We're not trying to replicate or duplicate it in that sense.
How does a pharmacy owner that's listening to the show right now, what's the best way to get in touch with you so we can get a demo so that they can really learn more about the platform?
The best way to get in touch is to check us out on our website, scripted.co. And from there, we will get in touch with you and show you everything that the platform has to offer.
David and Jimmy, I want you guys to come back on This Week in Pharmacy sometime. Bring a pharmacy owner with you so we can really dig into how the program has impacted their business, how the revenue has increased, and how the value to the community, which is the most important, has really come through Scripted in the partnership with Independent Community Pharmacy. Thanks for being on the show.
Thank you so much. We love it.
Thank you for having us.
Hello, I'm Samantha Pomeroy, Director of Pharmacy Services at IPC, and you're listening to the Pharmacy Podcast.
Sam, thanks for joining me on the McKesson ideaShare 2026 post show. This is great to see you and spend some time with you. You've been so busy.
I have been. It's been a great show. We have a lot of members here this year, and we've had some really, really good conversations. It's like air is coming back into my lungs,
Yeah.
You know what I mean? Because, I talk to the pharmacies virtually all the time, but getting to see them in person just gives me an extra pep in my step to keep going. And it's like I can breathe air into my lungs, and I'm like, okay, we're all in this together. We're gonna make it, and continue on in the next year to do good things. So
The energy difference from last year's conferences, where everybody was so frustrated and we all felt beat up, and then this is a different vibe this year, and I like it. I can feel it. I can hear the interviews that we've had, the partners of IPC, some of your members. It's just been wonderful. You have a program, What's Old has become new again. Describe to our listeners kind of like an audit back on some of your own services to assure that members are getting what they should be getting out of their businesses.
Yeah. So this year, at the beginning of the year, we have we work with PQS, who hosts the Equip platform, and we work closely with them to make sure that our members are taking every advantage of the opportunities they have in patient adherence to gain those dollars. Right? And so what we did at the beginning of the year was we really analyzed this data, and we saw that so many of our pharmacies don't even log into the Equip platform. And I kind of understand that, because when I was behind the counter, the ROI just was not there, which this was about 6 years ago. So the ROI just wasn't there for us to work on it and, put a technician on it or a pharmacist on it. It just didn't pay us back to do it. So that's why we say what's old is new again, because there's been so many changes that I think that people don't understand with the plan changes and how it is a little bit easier to gain those dollars. So this at IPC for our members is called the Top 50 Revenue Recovery Initiative for Payer Performance. And so we chose 50 of our members that had the most potential in dollars in 2025 left on the table that they didn't tap into at all. And over 50 pharmacies, it was $4.5 million that they didn't tap into. So obviously we want to help them gain those dollars in 2026, and that is already something that's currently in their operations and something they can start working on immediately. It's not a program they have to come in and set up and, advertise it, and, it's already within their operations. They can truly gain these dollars and have better outcomes. So what I want to say, sitting here talking to you and the listeners, is if you haven't logged into Equip, please do so. Centene has had plan changes to where now in the LAMP program, actually, there are on-time fill bonuses, there are quarterly check-ins, and for that quarterly check-in now, you have to call the patient. Well, if the patient doesn't answer, you document that they didn't answer, but you made that attempt to reach the patient. You're still paid those dollars, even if you didn't talk to the patient. So there are so many different, new things within there that I think that it's just easier to reach those dollars, I think, than it has been in the years past. And so we've started working with pharmacies, and we are seeing great results. They're already earning dollars. They're calling me and saying, okay, please look at the platform again with me, make sure I'm not missing anything. So what we've gone in and done is help train the technicians and really help them to see where their low-hanging fruit is, because when you log in, if you do have a lot of patients attributed to your pharmacy in those different payer performance programs, it can be a little overwhelming. And so what I do is I will log in with them, and we will target, the patients that's really going to give them the biggest bang for their buck first. Okay. So, at the end of the year, hopefully they're getting at least 70% of those dollars that's attributed to their pharmacy. We do have one pharmacy that had about $275,000 just in one pharmacy. And he said, Samantha, I haven't logged in years. I said, I know, I see that you haven't, and I understand, but let's help you. So we're meeting with them once a month and with their technicians, and they have worked it into their workflow, and they're doing really, really good. So I just truly feel that these dollars are attainable for our stores. And so I think that this is a really good initiative for IPC to focus on this year.
This is wonderful news. We talked with Blair Thielemeyer from that team.
Mm-hmm. I love Blair. She's an Arkansas girl.
Yeah,
I'm from Arkansas. So,
yeah, exactly. Yeah. And it's good to see that there are tools out there that can dig into the data and uncover things that you're too busy as a pharmacy owner to sit there with an Excel spreadsheet, a calculator, and digging into things. And with today's technology and with artificial intelligence, there's always these tools to uncover pockets of revenue that you may be missing, and you need it. You need it to operate. You need it to keep growing.
Absolutely, you do. Yeah.
So we want to hear more from you, Samantha. Thank you so much for being on the show, participating, and we'll be right back with more coverage of the McKesson ideaShare.
Thank you.
Hi, this is Sallie Rafie from Birth Control Pharmacist, and you're listening to the Pharmacy Podcast.
Sallie Rafie back on the Pharmacy Podcast Network. It's so good to see you here in Denver.
Always a pleasure, Todd.
All right, so the reason why I like having you back, several reasons. Number one, you're just an incredible pharmacist that's very servant leader driven. Your whole mission has been to bring more education, not only to the pharmacists, but we know the impact that they make on their community around birth control, around contraception and family planning, menopause. There aren't a lot of pharmacists who are really dialed into that portion of healthcare, and women's health has quickly risen to the top of many different podcast discussions that we've had. Let's open up about that. What is it about women's health now that it's getting more attention than ever before?
A lot of different pieces are getting attention. Perimenopause and menopause are definitely in the spotlight right now, which is a good thing because people are realizing that a lot of the scary thoughts of hormones were actually based on data that is no longer being misinterpreted, and people are embracing the safety and effectiveness of hormone therapy when initiated in the early menopause years, which is wonderful because women don't need to suffer in silence around that. So I'm so glad that people are more open to getting help with that, and providers also getting more educated because we need that. On the other side of things, contraception and family planning is also getting a lot of attention. There have been a lot of attacks on reproductive health in this country in the last year and decade even, and folks are realizing more and more how essential community pharmacies are as access points to that care.
Sallie, there are parts of the United States who had centers, Planned Parenthood, for example. Those centers have been, for whatever reason, funding, politics, whatever, they've been shut down. The women, the people that go to those centers for services, they're not sure what to do. I don't know what gong to bang as loud as we can bang it, but it's our independent community pharmacists that have a true opportunity right now to educate their community and say, listen, you can come to this pharmacy to receive this specialized care and education, which is, I think, is even more, when you couple those two things, it's even more valuable. Talk to me about that. Talk to me about how the independent community pharmacy has a very unique opportunity right now.
Yeah, there are gaps that need to be filled, and independent pharmacies, community pharmacies can do that. We can provide that quality care that patients need, those access points. They love the convenience of coming to the pharmacy. That is the number one reason why they might choose to come to the pharmacy. They appreciate and are highly satisfied with the level of care we're providing, the counseling, the experience overall, and it's such an easy service to incorporate into the pharmacy's workflow.
Then there's the bigger picture. A pharmacist understands other things that are happening with an individual and the time of life that they're in. And if they're on other medications, or if they're having allergies, or if they're wanting to get, maybe they want to train for a triathlon or whatever's happening, this is also factored into how reproductive health and birth control and menopause services and knowledge kind of plays into that pharmacist opportunity.
Yeah, it's a part of every single one of our patients' lives. This is not an isolated patient population, it's everybody. And in the session this morning, we talked about this is a continuum throughout the woman's lifespan. She's going to spend decades preventing pregnancy, but also years trying to get pregnant and recovering from that pregnancy and the postpartum period and the mental health issues, and then transitioning to menopause. And throughout the entire lifespan, there's so much that pharmacies can do to support our patients through this, whether it be through our direct services, clinical prescribing services we're offering, whether it's facilitating care in collaboration with their other providers, providing referrals, helping them with over-the-counter items, supplements, ovulation tests, pregnancy tests. There is so much pharmacies can be doing. And now with our expanding scope of practice allowing us to either independently prescribe under protocol, standing orders, we can do the contraception a lot of times directly, STI testing and treatment, HIV testing and prevention. There is so much that our scope of practice is enabling depending on the state.
You just made a point that just gave me, brought some, not necessarily clarity, but this is more than just women's health. This is everybody's health, because the education that even a young man is getting or not getting, they could come and ask questions to their pharmacist. You and I, as we're walking into the conference hall to get ready for our interview, we were talking about the communication and the marketing of these services. Just because you're capable of doing it, just because you're in a state that allows a pharmacist to prescribe birth control services, the public doesn't have any idea that this might even be available. Would you talk to us about how the birth control pharmacist in your team is helping our independent community pharmacies to build profitable programs that really build that out to the community and communicate that out to the community?
Absolutely. We're trying to raise awareness among the general population. Just like they know they can go to the pharmacy for their vaccines, they need to know they can go to the pharmacy for their birth control and these other reproductive health services. We're doing that in a couple different ways. The first is on the internet, because that's where a lot of people go to. The interwebs. So we have a free directory, birthcontrolpharmacies.com. We have one for preppharmacies.com, and pharmacies can list themselves there so patients can help find them. Any pharmacy offering the service needs to have this on their website, and surprisingly, some don't. In addition, the in-store marketing is so low cost and so effective. We have hundreds of people walking through our pharmacy doors every week. And we shouldn't just be trying to target, women between age 20 to 40 with this. This is something we should generally be promoting and raising awareness around. Whether you're chatting about it during your vaccine appointments, whether it's on your voicemail line, you've got signage in the store. We have counter tents and window clings and bag stuffers for pharmacies, or you can make your own. But you got to get the word out about this stuff. I always wear my little pins, my I prescribe birth control pins, because it's a conversation starter. And you never know when someone says, that's so cool, I'm going to tell my daughter about that. I'm going to tell my granddaughter about that. So we have to plant those seeds, even if it doesn't convert to an immediate patient visit.
Sallie, there are a lot of pharmacists. We just talked to two different technology providers of voice technology that interacts with the incoming phone calls. Another gold idea that Sallie just shared for the listeners: if you have a voice system that is interacting with your caller, during that wait time, you should be announcing that, hey, we are a birth control prescribing or family planning, assistant pharmacy. Please ask us about family planning, or please ask us about birth control. It gives you an opportunity to if you don't let them know that you have it, they don't know that you have it. So it shouldn't be reactionary. It should be a little bit more proactive so that you get it out into the community that you're actually doing this so that they'll come to you for these services.
Absolutely. And we have a free marketing checklist on our website if folks want to make sure they've hit all of these easy, low-cost ways to get the word out.
All right. Give our listeners the best place to go on the interwebs to get a hold of you and to reach out.
Yeah, birthcontrolpharmacist.com is the best way to access all the resources you need to get this started.
Dr. Sallie Rafie, it's so good to have you on the show again. Thanks for being part of it.
Thanks so much, Todd.